Hi friends. So let's go to the next question. So this is a lady is presenting in front of her. She is 30 years old lady. Okay, and you are teaching. She's suffering from Reynolds phenomenon about a ways to prevent recurrent episodes. So you are teaching this lady how to prevent reoccurrence of Reynolds phenomena. Okay, that is our scenario here. So which instruction the nurse should include here? So this is also another SATA question. Okay, so you are telling her Reynolds phenomena how to prevent a reoccurring. So you are telling her first is avoid excessive caffeine. Second option is immerse hands in cold water. Third option, you are giving her practice yoga or tai chi. Fourth option is refrain from using tobacco products. Fifth is wear gloves when handling cold object. So this the Reynolds phenomena is a vasospastic. The This can happen on fingers, toes, ears, nose, breastfeeding moms on breast, or those areas this can get affected. Raynaud's phenomenon is a vasospastic disorder resulting in an episodic vascular response related to cold temperature or emotional stress. Okay, it could happen because of the emotional stress or cold temperature. The most commonly affect women. The age group is between 15 to 40. Vasospasm includes a characteristic color change in the appendages, example fingers, toes, ears, nose. When vasoconstriction occurs, the affected appendages initially turns white from decreased perfusion. So the blood circulation to this area is decreased. That is, it is going to spasm. Okay, that areas, followed by a bluish purple appearance due to cyanosis. Then it become turned to blue, then cyanotic. Okay, clients usually reports numbness and coldness during this stage. When blood flow is subsequently restored, the affected area becomes reddened and clients experience throbbing or aching pain. So during that numbness and coldness, but when the blood circulation restores, that's the time they feel throbbing or aching pain, swelling and tingling. Okay, acute vasospasm are treated by immersing the hands in warm water. That is one of the treatment. Okay, so those things are conservative management. So we do have a list of conservative management for these clients, so you can instruct. There are a handful of them. So the client teaching regarding prevention of vasospasm including, so we have to eliminate the wrong from our list. Okay, let's see what are the recommended conservative management. Okay, wear gloves when handling cold objects. So that is the wear gloves when handling cold objects is, there is a correct option. That was option number 5 there. Okay, so it's a correct option. Dress in warm layers, particularly in cold weather. That option is not there, but it is one of the conservative management. And the third one here is avoid extremes and abrupt changes in temperature. That option also not there, but you can instruct the patient is a conservative management. Avoid vasoconstriction drugs, example cocaine, amphetamine, ergotamine, pseudoephedrine, those things. Then avoid excessive caffeine intake. That's there in our option number 1. Okay, so avoid excessive caffeine intake. Then refrain from use of tobacco products. That is there in our option number 4. That's also a correct option. Then implement stress management strategy, example yoga, tai chi. That also, tai chi also there. So our option number 1, 3, 4 and 5 correct. They are avoid excessive caffeine, practice yoga or tai chi, refrain from using tobacco products, wear gloves when handling cold objects. Those are the correct one. Addition to that, they can put layers of clothes, avoid extreme weather, abrupt change, so avoid vasoconstricting drugs, those types. Okay, then if these measures are not working for this patient, then they have to put on drugs. Like if conservative management is unsuccessful, clients may be prescribed calcium channel blockers to relax arterioles, smooth muscles, and prevent recurrent episodes. So then the patient has to be put on medication. Okay, so now let's see, the cold water will cause vasoconstriction, not vasodilatation, so that makes the situation more worse. Okay, and worsen the condition. The educational objective here is Raynaud's phenomenon is a vasospastic disorder triggered by exposure to cold or stress. Key elements of client teaching include management of acute attacks. So that's a key element, is how you can avoid recurrent and acute attacks, or avoidance of vasoconstrictive substances. Example, tobacco, cocaine, caffeine, stress reduction and appropriate clothing. Example, gloves, warm layers. Okay, so that's it. Let's see the next question. Here a client is admitted in your unit with moderate to large pericardial effusion, is admitted for monitoring. Okay, the nurse performs a head to toe assessment. Which of the findings indicate likely cardiac tamponade and requires immediate intervention? Select all that apply. This also a SATA questions, has more weightage. So this is more, means this really a clinical situation. Okay, so with experiences comes, but still as a beginners also you can learn it, and when you see the clinical situations you can make sure, this is what I learned in the theory, and this is what it is. So let's see if the patient is developing cardiac tamponade. So let's see what are the options here. Blood pressure of 90 by 70 mmHg. So you see 90 by 70, so pulse pressure is narrowed. Then bounding peripheral pulses, second option. Third option is decreased breath sound on left side. Fourth is distant heart tones. So let's see how many are correct, and why they are correct, and why the other options are wrong. Okay, so let's see now. So then one more option there, jugular venous distension. The vein here, jugular venous distension. So assessment findings, what are the features of cardiac tamponades are clinical features. Okay, so focus on the points now. Assessment findings there. Narrowed pulse pressure. Yes, it was there in our option. Yes, it is there. Muffled heart sounds. It's muffled heart sound. What was here? Here bounding peripheral pulse. Okay, that was given. That's wrong. Then distant neck veins. So when this patient get cardiac tamponade, you'll see so prominent and distant neck veins you will see. Okay, neck veins and distended superior vena cava, and then pericardial effusion, reduced left ventricular cavity space, then interventricular septum deviation, pericardium. These all clinical features you will see in cardiac tamponade. So I'll read once again what are the clinical features you will see. So pericardial effusion you will see, then reduced left ventricular cavity space, then interventricular septum deviation, then pericardium, distended superior vena cava. Okay, now pericardial effusion is, now what is these clinical situations, means the clinical features are said. So let's see what are they. Okay, the pericardial effusion is a building up of fluid in the pericardium. So what happens, the fluid rushes in the pericardial cavity, and it doesn't allow the heart to fill and contract properly. So it takes a place, and if something is there, how the heart will get filled up in the cavity if something is there. Tamponade is a serious complication of pericardial effusion, develop as the effusion increases in volume and result in compression of the heart. That's what the pathophysiology is. So the blood is filled in the pericardial cavity. So the heart is not able to fill inside and contract well and push out the blood. That's what happened. So the heart struggles to contract effectively against the fluid. So because of the fluid, it's become helpless, for the heart to contract properly, and cardiac output decreases. So what is the means that is the problem. So cardiac output is decrease here drastically. That also drastically, because we have a moderate which is what is our content? Moderate to large pericardial tamponade situation. So it's a large moderate. If it is mild, still it is still patient will be symptomatic, but this is moderate to large. Okay, so it's more life threatening. This life threatening complication requires an emergency pericardial synthesis. So what they do is a needle is inserted in the pericardial space and sac and remove the fluid. Okay, when that fluid is removed, okay, the heart can fill more blood and contract effectively and push blood to the to our body parts. Okay, so what are the sign and symptoms of cardiac tamponade? Now they are hypotension with the narrowed pulse pressure. That was our narrowed pulse pressure was our first option. That is correct. Then muffled or distant heart tones. That was there our option number 4. It was distant heart tone. Okay. Then the fifth option was jugular venous distension. Yes, the veins are distended. That was our correct option. Then pulsus paradoxus. So this one also a sign and symptom. Pulsus paradoxus is exaggerately falling the blood pressure of the patient during inspiration of the and that is greater than 10 mm of Hg. That is the pulsus paradoxus. So during the inspiration, the blood pressure drops. Okay, during inspiration. That is a symptom of a cardiac tamponade. Okay, then other symptoms are dyspnea. Patient will be tachypneic and tachycardic. Okay, these are the symptoms you will see. Then option number 2, why it is wrong. So bounding pulses may be present during when fluid overload or hypertension, like that situation you will see bounding pulses, not in cardiac tamponade. Okay, they may also present with anxiety or fever. If the patient is having fever or anxiety, pulse will be going high and this bounding pulse. The client with the possible tamponade will have a evidence of decreased cardiac output and is more likely to have a weak thready pulse. So they'll have weak thready pulse because decreased cardiac output. Yeah, that's the reason. Then the option number 3, why it was wrong, decreased breath sound on the left side are not specific to this scenario. It's not. It's not the development of cardiac tamponade symptom. So decreased breath sound could indicate conditions such as atelectasis, like it's a lung collapse, okay, or pleural effusion. There is fluid collection in the pleural cavity, or pneumothorax, air in the thoracic thoracic cavity. Okay, these are the situations you will see decreased breath sound. Okay, not in cardiac tamponade. Okay, education objective here. The client with a moderate to large pericardial effusion is at risk for the development of cardiac tamponade. Signs and symptoms of tamponade include muffled or distant heart tones, narrowed pulse pressure, jugular vein distension, pulse paradoxus, dyspnea, tachypnea, and tachycardia. The nurse report these findings to the healthcare provider immediately and prefer for a pericardiocentesis. Okay, that is an immediate attention to be taken from the healthcare provider and do an immediate management for this removal of fluid from the pericardium. Okay, let's go to the client round. Okay, so that's it in this video. Next, I'll see you in the next video soon.